Have you ever heard someone say, you can dissolve artery plaque naturally, or just eat this one food and your arteries will become clean again? It sounds hopeful. It sounds powerful. And honestly, it sounds like the kind of thing many people want to believe, especially if they have high cholesterol, high blood pressure, diabetes, chest discomfort, or a family history of heart disease. But here's the truth most people never hear clearly. Artery plaque is not like dirt inside a pipe that you can simply wash away overnight. It is a complex buildup inside the artery wall made from cholesterol, fatty substances, calcium, inflammatory cells, and other materials. Over time, this plaque can narrow arteries, reduce blood flow, and increase the risk of heart attack, stroke, and circulation problems. The American Heart Association explains that atherosclerosis happens when plaque deposits build inside arteries and make them narrower and less flexible. So, can artery plaque really shrink? The answer is, in some cases, yes, but not magically, not instantly, and not from one simple trick. What often matters even more than melting plaque is making plaque less dangerous. A smaller plaque is good, but a more stable plaque is also extremely important. A stable plaque is less likely to rupture and cause a sudden blood clot, which is one of the major ways heart attacks and strokes can happen. In this video, we are going to break down what artery plaque really is, what it means when doctors talk about plaque regression, what habits can support healthier arteries, and why the biggest mistake is waiting until symptoms become serious. Let's start with the biggest misunderstanding. Most people imagine artery plaque like grease stuck inside a kitchen drain. They think if they eat the right food, drink the right juice, or take one supplement, the plaque will break apart and flush out. But your arteries are living tissue. Plaque develops inside the artery wall as part of a long process involving cholesterol, inflammation, blood pressure, smoking, diabetes, genetics, and age. This is why quick fixes are dangerous. If someone already has coronary artery disease, severe narrowing, chest pain, shortness of breath, or a history of heart attack or stroke, they should not rely on internet remedies. Medical care matters. Mayo Clinic says treatment for atherosclerosis may include lifestyle changes, medicines, and sometimes procedures, depending on the person's condition. But here is the hopeful part. Doctors now know that plaque progression is not always one way. In some people, with intensive risk factor control, plaque can become more stable and sometimes even shrink. This is especially linked to lowering LDL cholesterol, often called bad cholesterol, and controlling the deeper drivers of plaque growth. The Cleveland Clinic explains that statins can reduce cholesterol and fat inside plaques, which may shrink them over time and lower the chance of blockages. Mayo Clinic also notes that some cholesterol medicines can reduce plaque buildup and may even reverse fatty deposits in arteries. But this does not mean everyone can reverse plaque with lifestyle alone. It also does not mean plaque disappears quickly. For many people, the realistic goal is to slow progression, stabilize plaque, reduce inflammation, lower cholesterol, protect blood pressure, improve blood sugar, and reduce the risk of heart attack or stroke. That may not sound as dramatic as clean your arteries in 7 days, but it is far more honest and far more useful. Now let's talk about what actually drives plaque growth. One of the biggest drivers is high LDL cholesterol. LDL can enter the artery wall, especially when the inner lining of the artery is damaged or inflamed. Over time, cholesterol particles can become trapped, immune cells respond, and plaque begins forming. The American Heart Association says high cholesterol contributes to plaque that can clog arteries and lead to heart disease and stroke. But cholesterol is not the only factor. High blood pressure damages artery walls by placing constant force on them. Smoking harms the blood vessels and lowers protective HDL cholesterol. Diabetes and insulin resistance increase inflammation and make blood vessels more vulnerable. Lack of exercise, poor sleep, chronic stress, excess weight, and unhealthy eating patterns can all add pressure to the system. That is why plaque is not usually caused by one thing, and it is not solved by one thing. The real solution is a pattern of eating better, a pattern of moving more, a pattern of controlling cholesterol, a pattern of controlling blood pressure, a pattern of quitting smoking, a pattern of managing diabetes, a pattern of taking medication when it is prescribed, a pattern of checking your numbers instead of guessing. So what can help support healthier arteries? The first major step is knowing your cholesterol numbers. Many people say, I feel fine, so my arteries must be fine. But artery plaque can grow silently for years. A person can have high LDL cholesterol and feel completely normal. That is why blood tests matter. The key numbers often include LDL cholesterol, HDL cholesterol, triglycerides, total cholesterol, and sometimes ApoB or lipoprotein A, depending on a person's risk. Some people have inherited cholesterol problems and may need medical treatment even if they eat well. This is important because a person can look healthy, exercise, and still have genetically high cholesterol. This is where many viewers need to hear the truth. Lifestyle is powerful, but it does not erase genetics for everyone. Some people can lower LDL significantly through food, weight loss, and exercise. Others need medication. And needing medication does not mean failure. It means the risk needs stronger control. The American Heart Association lists healthy eating, physical activity, and medications as part of preventing and treating high cholesterol. For people at higher risk, medication may be one of the most important tools for preventing serious events. The second step is improving your food pattern. Notice the word pattern, not one miracle food, not one drink before bed, not one fruit that dissolves plaque. A heart-supportive diet is built over time. A strong artery-friendly pattern usually includes more vegetables, fruits, beans, lentils, oats, barley, whole grains, nuts, seeds, and healthy fats like olive oil. It often includes fish for those who eat it, especially fatty fish. It limits trans fats, heavily processed foods, sugary drinks, excess refined carbohydrates, and large amounts of saturated fat. The goal is not to make food boring. The goal is to reduce the daily inputs that raise LDL cholesterol, blood pressure, blood sugar, and inflammation. Soluble fiber is especially helpful because it can help lower LDL cholesterol. Foods like oats, beans, lentils, apples, barley, and psyllium fiber are often used in heart health eating patterns. Replacing butter, ghee, high-fat processed meats, and deep-fried foods with healthier fats can also support better cholesterol levels. But here is a critical point. Eating one healthy food while the rest of the diet stays harmful will not do much. You cannot eat oats in the morning and then spend the whole day eating fried snacks, sugary drinks, processed meats, and desserts, and expect the arteries to be protected. The body responds to the overall pattern. The third step is movement. Exercise is not just about weight loss. It helps blood vessels function better. It can improve blood pressure, insulin sensitivity, HDL cholesterol, triglycerides, circulation, and inflammation. The American Heart Association says healthy habits such as physical activity, not smoking, healthy eating, enough sleep, and maintaining a healthy weight can reduce heart disease risk factors. For many adults, a realistic starting point is walking. Not extreme workouts, not punishing the body, just consistent movement. A 10-minute walk after meals can help blood sugar. A daily brisk walk can help the heart. Light strength training can help preserve muscle, which becomes especially important with age. If someone has chest pain, severe shortness of breath, dizziness, or known heart disease, they should ask a clinician before starting intense exercise. The goal is consistency. Because the arteries do not change from one heroic workout, they change from repeated daily signals. The fourth step is blood pressure control. High blood pressure is one of the most silent artery-damaging forces. It can damage the inner lining of blood vessels, increase the workload on the heart, and raise the risk of heart attack and stroke. Many people do not know their blood pressure because they only check it when they visit a doctor. But blood pressure can change with stress, sleep, salt intake, weight, medication, and activity. Home monitoring can be useful for many people, especially if recommended by a healthcare professional. Food can help here too. Reducing excess sodium, eating more potassium-rich foods if safe for the kidneys, losing excess weight, exercising, limiting alcohol, and improving sleep can all support healthier blood pressure. But again, some people need medication, and that should not be ignored. The fifth step is quitting smoking and avoiding nicotine. This is one of the biggest artery protective decisions a person can make. Smoking damages blood vessels, increases clotting risk, reduces oxygen delivery, lowers HDL cholesterol, and accelerates plaque formation. The American Heart Association notes that smoking lowers good HDL cholesterol and increases heart disease risk. If a person smokes, quitting is not just good advice. It is one of the most powerful steps for reducing future cardiovascular risk. Even if cholesterol is controlled, smoking keeps harming the arteries. And this includes vaping or nicotine products too. People often switch products and think the risk is gone. But nicotine can still affect blood vessels and blood pressure, and inhaled chemicals may have their own risks. The sixth step is managing blood sugar. Diabetes and insulin resistance can speed up plaque buildup. High blood sugar can damage blood vessels and increase inflammation. Many people are in the pre-diabetes range without knowing it. This is why checking fasting glucose, A1C, and discussing metabolic risk with a healthcare professional can be important, especially for people over 40, people with excess belly weight, people with family history, or people who feel tired after meals. Better blood sugar control often comes from a combination of food quality, portion control, movement after meals, sleep, weight management, and sometimes medication. The seventh step is sleep. Sleep is underrated in heart health. Poor sleep can raise stress hormones, worsen blood pressure, increase hunger, worsen insulin resistance, and make it harder to maintain healthy habits. Sleep apnea is especially important. Loud snoring, choking during sleep, morning headaches, daytime sleepiness, and high blood pressure can be warning signs. Untreated sleep apnea can stress the heart and blood vessels. Someone with these symptoms should speak with a medical professional. The eighth step is reducing chronic inflammation. Inflammation is part of plaque development and plaque instability. This does not mean every inflammation claim online is useful. It means the body's long-term inflammatory state matters. What contributes to chronic inflammation? Smoking, poor sleep, excess visceral fat, uncontrolled diabetes, gum disease, autoimmune conditions, ultra-processed diets, sedentary lifestyle, chronic stress, poorly managed infections, or inflammatory conditions. This is why heart health is not just a cholesterol conversation. It is a whole body conversation. The ninth step is weight management, especially waist size. Not everyone with artery plaque is overweight, and not everyone with extra weight has the same risk. But excess visceral fat around the abdomen is strongly linked with insulin resistance, inflammation, fatty liver, high triglycerides, and blood pressure problems. Even modest weight loss can improve risk factors for many people. A person does not need a perfect body to improve heart health. Losing even a small percentage of body weight can help cholesterol, blood pressure, and blood sugar in some individuals. The 10th step is taking prescribed medication seriously. This is where many online videos become dangerous. They create fear around medicines and make people believe lifestyle alone is always enough. But for many people, especially those with known coronary artery disease, previous heart attack, stroke, diabetes, very high LDL, or high risk, medication can be life-saving. Statins are among the most studied cholesterol-lowering medications. They lower LDL cholesterol and can also help stabilize plaque. Some people may need additional medications such as ezetimibe or PCSK9 inhibitors, depending on risk and cholesterol response. Cleveland Clinic reported that in a study using intravascular ultrasound, plaque regression was seen more often in people taking a statin plus an injectable cholesterol-lowering drug than in those taking a statin alone. This does not mean everyone needs that drug, but it shows how aggressively lowering LDL can affect plaque biology in some patients. Now let's address the question directly. Can artery plaque really shrink? Yes. Plaque regression can happen, especially when LDL cholesterol is lowered significantly and risk factors are controlled. But the amount of shrinkage may be modest, it may take time, and it usually requires a serious, consistent plan. More importantly, plaque can become more stable, less inflamed, and less likely to rupture. That is why the goal should not be, how do I clean my arteries by next week? The better question is, how do I lower my future risk starting today? Because risk reduction is the real prize. A person can reduce risk even if plaque does not completely disappear. If blood pressure improves, LDL drops, smoking stops, blood sugar improves, weight improves, and inflammation decreases, the heart is in a safer position. Now let's talk about signs people should not ignore. Chest pressure, chest tightness, pain spreading to the arm, jaw, back, or shoulder, shortness of breath, sudden sweating, nausea, unexplained fatigue, dizziness, or fainting can be warning signs of a heart problem. Stroke symptoms such as face drooping, arm weakness, speech trouble, sudden confusion, sudden vision problems, or sudden severe headache need emergency care. Do not try a home remedy for these symptoms. Do not wait to see if it passes. Emergency symptoms need emergency help. For people who do not have symptoms, prevention starts with numbers. Ask your healthcare professional about cholesterol, blood pressure, blood sugar, weight, waist size, kidney function, and personal risk. People with family history of early heart disease may need earlier or deeper evaluation. Some may need tests beyond basic cholesterol, depending on their risk. Now let's build this into a simple, viewer-friendly plan. Number 1. Know your LDL. If you do not know your LDL, you are guessing. LDL is one of the most important drivers of plaque growth. High LDL does not usually cause symptoms, so testing is essential. If your LDL is high, ask your doctor what target makes sense for your risk level. Number 2. Eat for lower LDL. Add soluble fiber daily. Choose oats, beans, lentils, vegetables, fruits, and whole grains. Replace saturated fats with healthier fats when possible. Reduce processed meats, deep-fried foods, and packaged snacks. Do not focus on one magical ingredient. Focus on repeated meals that support your arteries. Number 3. Move every day. Walking is powerful when it is consistent. Start where you are. If you can only walk 5 or 10 minutes, begin there. Add time gradually. Include strength training if safe for you. Movement helps the heart, blood vessels, blood sugar, blood pressure, and mood. Number 4. Control blood pressure. High blood pressure is like constant pressure against the artery wall. Check it. Track it. Discuss it. Reduce excess salt. Move more. Sleep better. Take prescribed medicine if needed. Number 5. Quit smoking. This one step can change your future risk dramatically. If quitting feels hard, that does not mean you are weak. Nicotine is addictive. Get help. Use medical support if needed. Number 6. Protect your sleep. Poor sleep can make everything harder. Weight, hunger, blood pressure, blood sugar, stress, and exercise motivation. If you snore heavily or wake up choking, ask about sleep apnea. Number 7. Do not fear medicine when it is needed. Lifestyle and medicine are not enemies. They can work together. For high-risk people, medication may be the difference between plaque continuing to progress and plaque becoming more controlled. Number 8. Avoid miracle claims. Any video, product, or supplement that says it will dissolve plaque fast should make you cautious. Real artery health is measured through risk factors, medical evaluation, and long-term outcomes, not dramatic promises. Now let's make the message more emotional. Many people only think about their arteries after something scary happens. A chest pain episode, a hospital visit, a friend's heart attack, a doctor saying, "Your cholesterol is too high." But the best time to protect your arteries is before the emergency, because plaque builds quietly. It does not ask permission. It does not always give warning. It does not always cause pain early. And by the time symptoms appear, the problem may already be serious. But that does not mean you are helpless. Every better meal is a signal. Every walk is a signal. Every cigarette avoided is a signal. Every blood pressure check is a signal. Every night of better sleep is a signal. Every dose of prescribed medication taken correctly is a signal. Every follow-up appointment is a signal. You are telling your body, we are changing direction. And that is the real hope. Not a fantasy where plaque disappears overnight, but a real possibility where your risk can come down. Your arteries can function better, your plaque may become more stable, your cholesterol can improve, your blood pressure can improve, your future can become safer. Now, there is another thing most people do not understand. Plaque size is not the only danger. Some plaques are dangerous because they are unstable. A plaque with a thin cap and high inflammation may rupture, causing a clot. That clot can suddenly block blood flow. This is why someone can have a heart attack even without knowing they had a severe blockage before. So when doctors treat artery disease, they are not only trying to open arteries, they are trying to reduce the chance of sudden plaque rupture, lowering LDL, controlling blood pressure, stopping smoking, and reducing inflammation all support this goal. That is why stabilizing plaque may be just as important as shrinking plaque. Now let's talk about supplements, because viewers will ask. Some supplements may slightly affect cholesterol or blood pressure, but they are not a replacement for medical care. Supplements can also interact with medications, affect the liver, thin the blood, or give people false confidence. If someone is taking heart medication, blood thinners, blood pressure medicine, diabetes medicine, or cholesterol medicine, they should ask a healthcare professional before adding supplements. Also, natural does not always mean safe. A natural product can still raise bleeding risk. A natural product can still affect the liver. A natural product can still interact with prescription drugs. A natural product can still be contaminated or mislabeled. The strongest natural tools are not usually pills. They are daily habits: food, movement, sleep, weight, stress control, not smoking, and regular medical monitoring. Now let's include a powerful example. Imagine two people. Person A hears they have high cholesterol. They feel fine, so they ignore it. They keep eating the same way, avoid exercise, never check blood pressure, and believe symptoms will warn them early. Person B also hears they have high cholesterol, but they take it seriously. They ask about LDL. They change breakfast from sugary refined food to oats and fruit. They walk after dinner. They reduce fried foods. They check blood pressure at home. They stop smoking. They take prescribed medication. They follow up with their doctor. After 1 year, person B may not have perfect arteries, but their risk profile may be completely different. Lower LDL, better blood pressure, better blood sugar, better stamina, less inflammation, less plaque progression, possibly more stable plaque, possibly some plaque regression, depending on their treatment and risk factors. That is how real change happens. Not through panic, not through one miracle food, not through ignoring doctors, through consistent action. Now let's write a section for older viewers. If you are over 50, over 60, or over 70, do not think it is too late. Artery health can still improve at older ages. Blood pressure can still improve. Cholesterol can still improve. Fitness can still improve. Smoking cessation still helps. Better nutrition still helps. Medication can still reduce risk. But older adults should be careful with extreme advice. Do not suddenly start intense exercise without medical guidance if you have heart symptoms or known disease. Do not make major medication changes alone. Do not follow restrictive diets that cause weakness, dizziness, or poor nutrition. The safest approach is steady improvement. Walk more. Eat more whole foods. Get protein from heart-supportive sources. Reduce excess saturated fat. Manage salt. Stay hydrated. Check your numbers. Work with a clinician. Now let's talk about what people should ask their doctor. Ask, what is my LDL cholesterol? Ask, what should my LDL target be based on my risk? Ask, do I need medication or can I start with lifestyle? Ask, what is my blood pressure goal? Ask, should I be checked for diabetes or prediabetes? Ask, does my family history increase my risk? Ask, should I be tested for lipoprotein A? Ask, what symptoms should make me seek emergency care? Ask, how soon should I repeat my labs? These questions are powerful because they move you from fear to information, and information helps you take control. Now let's prepare the conclusion. So, can artery plaque really shrink? Sometimes, yes. But the bigger truth is that plaque can often be slowed, stabilized, and managed. The goal is not to chase a fantasy of overnight artery cleaning. The goal is to reduce the risk of heart attack, stroke, and circulation problems with real steps that actually matter. Lower LDL, control blood pressure, stop smoking, move daily, eat a heart-supportive diet, manage blood sugar, sleep well, reduce chronic inflammation, take prescribed medication when needed, get regular checkups. That is what most people do not know. Your arteries are not protected by one secret trick. They are protected by the daily choices that keep repeating. And the best time to start is before the warning signs appear. So if you have high cholesterol, high blood pressure, diabetes, chest discomfort, shortness of breath, a family history of heart disease, or you simply have not checked your numbers in a long time, make this the moment you stop guessing. Talk to a healthcare professional. Get your numbers checked. Build a plan. And remember, you do not need to be perfect to lower your risk. You just need to start moving in the right direction. And keep going. If this video helped you understand artery plaque more clearly, subscribe for more simple, honest heart health education. And before you leave, comment below, do you know your latest LDL cholesterol number?